Okay, I'm still checking. It says it is streaming, but I don't know. Hello? Okay, I'm still checking. Okay, now it's working. So guys, welcome to my channel Study Medicine with me. And in this channel we study about the various topic of medicine directly from the PDF of the books. And today we're going to study the topic infertility from the gynec. It is a part of a topic of a gynecology, and this PDF is actually the gynecology of DC DUTTA. So if you heard about, so you might have heard about the writer and this book. So it is from the DC DUTTA, and today we're going to study the infertility. So let's go. So let's start with the definition of infertility. Okay. Okay, there's something I need to change. Infertility from DC DUTTA. So our channel's name is Study Medicine with Me, if you have heard that. Okay. And I think I'm the only one who is watching. So if there is anyone who is watching, then you could give me a sign by commenting on this stream or liking on this stream. So let's start. So infertility is one of the one of the important topic in case of gynecology, and the gynecologist generally comes with various cases of infertile women specifically, and since the people are not able to have children, they will ultimately come through the gynecologist, because you know that the various reproductive organs are specially related to gynecology. However, there are other hormonal factors that affects infertility, which we will be dealing in this chapter, I guess. So this is a new chapter for me as well, so I'm studying. So infertility. So what is the definition of infertility? Infertility is defined as a failure to conceive within 1 or more years of a regular unprotected coitus. Okay, so they are regular unprotected coitus. Okay, failure of conceive with 1 or more years. Okay, if the two couples are trying to have baby for more than 1 or 2 years, or failure to 1 or more years, and they are not able to conceive, then there is infertility. Okay, so infertility can be categorized into two, I guess: primary fertility and secondary fertility. So let's see what is primary fertility. Primary fertility denotes those patients who have never conceived, okay, who have never had children in past. However, the secondary fertility will certainly indicate that previous pregnancy. Okay, so there have been previous child, but right now they are not being able to conceive. So this is secondary fertility, and this is primary fertility. Okay, so there is another new term called fecundability. Fecundability. So what is fecundability? Fecundability is defined as a probability of achieving a pregnancy within one menstrual cycle. Okay, what is so let's suppose that women have a the woman have almost about 12 menstrual cycle, or more than 12 menstrual cycle in a year. So in just forget this. Within one menstrual cycle, what is the probability of a woman to conceive in 0 to 30 days? So it is about 20% in case of normal. So this is called fecundability. It is probability of achieving a pregnancy within one menstrual cycle. So in a healthy young couple, it is 20%, as I've already discussed. So fecundability and fecundity is different. Is the probability of achieving a live birth within a single cycle. Fecundity is the probability of achieving a live birth within a single achieving a pregnancy with. Fecundity is the probability of achieving a live birth within a single cycle. Oh my god, I didn't understand. So these two terms are so similar. probability of achieving a live birth within a single cycle. Oh shit, man, there is a mistake. I forgot to set up the screen. I think I need to start it over again. Oh shit. Okay, you guys are being able to are able to see this, right? Yeah. Okay. So I want to go through it again. Okay. Infertility is defined as a failure to conceive within 1 or more years, regular unprotected coitus. Primary infertility denotes the patient who have never conceived, okay? And secondary infertility indicates the previous pregnancy but failure to conceive subsequently, okay? Fecundability is defined as the probability of achieving a pregnancy within one menstrual cycle. So in a healthy young woman or couple, it is okay. So fecundability actually depends to the couple. Okay, it is 20%. So for the different for the different pair, it might be different. For example, if an woman is having relationship with one person, okay, their fecundability would be different from the same woman with the other male. Okay, it might be different. It might, because fecundability might depends upon male as well as female. So let's talk about the incidence. Okay, 80% of the couple achieving conception if they desire within 1 year having irregular intercourse with adequate frequency 4 times. Okay, that's a lot of time. 80% of the couple achieving conception if they so desire within 1 year of having irregular 4 times. Under 10% will achieve the objective by the end of the second year. As much as 10% remains infertile by the end of the second year. Factor essential for conception. Okay, what are the factors that are essential for the conception? Conception is basically meeting of a ova and the sperm. So healthy spermatozoa, obviously the sperm should be healthy, should be deposited high in the vagina or near the cervix. Okay, the depositing method should be good as well. Okay, it depends upon healthy spermatozoa. The spermatozoa should undergo changes, capacitation across. Okay. So spermatozoa actually changes its characteristic when it moves to the when it moves to the fallopian tube, I guess. Yes, and the term given is actually called as capacitation. So spermatozoa should be able to undergo capacitation process. And acrosomal reaction is the so capacitation is the change in the sperm when it reaches the fallopian tube. And acrosome reaction is the change. It's basically the proteolytic reaction that occurs when sperm meets the external layer of the ovum, so that it could enter inside. Okay, so these two methods. Okay, the spermatozoa will be healthy and it should be able to undergo changes. So the motile spermatozoa should ascend through the cervix into the uterine cavity and fallopian tube. Okay, so there might be a motile spermatozoa which is motile should ascend through the cervix into the uterine cavity and okay, the motility of spermatozoa is also important factor. So health of the spermatozoa changing capacity of a spermatozoa and the motility of a spermatozoa is important. There should be ovulation. Okay, the other factor is these three were the factor for the sperms, or basically the factor for the male, and there should be a ovarian factor. Okay, there should be ovulation. What is the okay? There should be ovulation. Ovarian factor is also important. The fallopian tube should be patent and oocyte should be picked up by the fimbriated end of the tube. This should be ovulation. Fallopian tube should be patent. Okay, fallopian should be patent and the oocyte should be picked up by the fimbriated end of the tube. Okay, the fallopian should be patent, meaning I think it means that fallopian tube should be as it is, and there should be a passage for the ovum to go, and oocyte should be picked up by the so the and the oocyte there are various end of the fallopian tube, and the oocyte is generally picked up by the fimbriated end of the tube, so it should be done. So these are the female factors. Okay, sorry. Okay. The spermatozoa should fertilize the oocyte at the ampulla of the tube. Spermatozoa should fertilize. Okay, there should be so fertilization. So this is the factor actually that depends upon the both male and female. Technically, okay. So the health of the spermatozoa, changing capacity of the spermatozoa, and the motility of spermatozoa is important. And there should be ovulation. So this actually depends on the spermatozoa, and for the ovum it should be ovulation. Okay, and the fallopian tube should be patent, and there should be uh, uh, and yes, and the ovum should be actually picked up by the fumulated end of the tube, and okay, and the fertilization should occur at the ampulla of the tube. The embryo should reach the uterine cavity. Okay, after the formation of an embryo, there might be condition of infertility. So embryo should reach the uterine cavity after 3 to 4 months. Okay, days of the fertilization. So it should be okay. It actually depends on the cilia of the fallopian tube. I guess this process should be okay. This is in deep. Okay, the endometrium should be receptive by estrogen, progesterone. For cytokines indicates for implantation. Okay, endometrium should be received. Okay, should be receptive. Okay, so health of the endometrium is also very important for fertilization, for especially the implantation of an embryo into the endometrium. So the endometrium should be receptive for the various hormones which are essential for the fertilization, such as there is estrogen, there is progesterone, and IGF meaning intrauterine growth factor 1, cytokine integrins. Okay, so it is important for the implantation, and the corpus luteum should be function adequately. These are the factors which are essential for the conceptions. So let's talk about physiological consideration. Okay, there is physiological consideration. Okay, due to anovulation in physiological consideration. Okay, due to anovulation, infertility is the rule prior to the puberty and after menopause. Due to anovulation, infertility is the rule prior to the puberty and after menopause. But it should be remembered that the girl may be pregnant even before the menarche and pregnancy. It's possible within. Okay, I completely get this start. I'm going to start it again. So physiological consideration. Okay, due to anovulation. Okay, infertility is the rule prior to the puberty and after the menopause. After the menopause. But it should be remembered that the girl may be pregnant even before the menarche. Okay. Girl may be pregnant even before the menarche. How come? How can it happen? Without menstruation, there can't be formation of an ovum. Oh, okay. Okay. So in first, if the woman have a sex, okay, if the female have a coitus just before, is considered if the female is having coitus even before the menarche, there might, okay, at the stage of the first menstruation, okay, there is formation of ovum okay, when there is first formation of a ovum, there is first ovum. When there is formation of first ovum, and at that time if it meets with the sperm, then technically there is no menstruation, and there is no menstrual cycle. However, there is fertilization has already occurred, and in this condition the female can have pregnancy, and it's possible within a few months of the menopause or not. I'm not getting this. Okay, conception. So let's consider that this menarche and menopause is actually a characteristic of a uterus rather than ovum. Characteristic of a uterus rather than ovum. However, ovum plays a very important role. So pregnancy can occur before the menarche and after the menopause as well. Conception is not possible during the pregnancy. Okay, during the pregnancy, conception is not possible as the pituitary gonadal axis is suppressed by the HCG and hence no ovulation. So HCG actually produced by the placenta placenta, and fetus also produces the HCG. So these actually inhibits the gonadal releasing hormone. Okay, gonadal releasing hormone that is produced by the hypothalamus. During the lactation, infertility is said to be relatively during the lactation, infertility is said to be relative. Okay, so however, in case of lactation, there is the case of infertility that is due to the production of a prolactin, which actually inhibits the gonadotropin releasing hormone from the hypothalamus as well. It works similar way as HCG. However, it is relative. It says this, despite the fact that the patient is amenorrheic during lactation. Okay, during lactation, patient is amenorrheic during lactation. Ovulation and conception can occur. Okay, ovulation and conception can occur in this period. However, in fully lactating woman, so there is data, I think, 5 to 6 times a day, and so spending 60 minutes. Okay, what the hell? Spending 60 minutes in 24 hours. Pregnancy is unlikely to up to 10 weeks postpartum. Okay, 10 weeks is roughly 2 months. So there is criteria 5 to 6 times a day, and minimum 60 minutes in 24 hours. Within 24 hours, the female should breastfeed about 1 hour, and the frequency is about 5 to 6 times a day, in order to prevent the pregnancy for about 10 weeks. 10 weeks is more than about 2 months. So what are the causes of infertility? This is very important. The conception depends. Okay, so for this we need to go through the various process of the fertilization, and it has given that as well. Let's see. Let's go on a brief. Let's visit the topic that we are going to read. So this is causes of infertility. So what are topic under the causes of infertility? Let's see. So there is fault in male detective sperm. Okay, there is fault given for the male, and there are various points, and they have defined all of those. Okay, causes of male infertility. Okay, defective spermatogenesis. No, they haven't explained all of them, but this defective spermatogenesis is given priority. Okay, what the hell, man? Fault in male and causes of male. Okay. So there are causes given: hormone factor, infection factor, general factor. Okay, what is this? Common causes of male infertility. Okay, there are other common causes also given right here in table. Pre-testicular, testicular, and post-testicular. Okay, it is categorized, and causes. Okay, endocrine. Okay. Okay. So let's go to the causes of male infertility. Let's study this. Okay, causes of infertility. Concept given the fertility potential of both male and female partner. Obviously, the male is directly responsible in about 30 to 40%, and the female is about 40 to 55%. Okay, the female is generally more responsible as the male. Okay, and both are responsible in 10% cases. Okay, the remaining 10% is unexplained. Okay, in spite of through investigation with a modern technical know-how, it is also strange that 4 out of 10 patients of unexplained category become pregnant with 3 months without having any specific treatment. It is also emphasized that the relative risk of infertility of one partner may sometimes be counterbalanced by the high fertility of the other. Fault in the male. This is defective spermatogenesis. Okay, obstruction of the efferent duct system, failure to deposit. Okay, sperm high in the vagina, error in the seminal fluid. Okay, there are 4 main factors: defective spermatogenesis that depend on the sperm. Okay, obstruction of the efferent ductal system. There might be obstruction in the ductal system, and there is a failure to deposit the sperm in the high vagina, and error in the seminal fluid. There might be error in the seminal fluid. So defective spermatogenesis. Okay, follicle stimulating hormone stimulates the spermatogenesis from the basal cells of the seminiferous tubules. Okay, so basal cells, we need to know about the basal cells of the seminiferous tubules. Okay, let's suppose this is seminiferous tubules. There are 2 types of cells, I guess. This one called as so suppose this is seminiferous tubule. This one called as Sertoli cells, and the other is called basal cells, I guess. Sertoli cells can envelop the organism germ cells. So Sertoli cells is basically enveloping the this long is called sexual cell. They are actually inverting the germ cells. So these dotted structures are germ cells. They are inverting the germ cell. Okay, and so the function of the sexual cell is actually controlled by the follicle stimulating hormone and testosterone. Okay, scrotal temperature should be 1 to 2 degree Fahrenheit less than body temperature. It's important to know this temperature. People often say degree centigrade, but it is actually given in Fahrenheit. 1 to 2 degree Fahrenheit less than body temperature. Okay, luteinizing hormone is required for the synthesis of testosterone from the Leydig cell. Okay, the Leydig cell is the other cell that is present posterior to the so Leydig cell is the other structure that is present posterior to the sexual cells, and these are responsible for production of the testosterone, and it is actually acquired by the sexual cells, and sexual cells therefore use that testosterone to mature the germ cells. Similarly, follicle stimulating hormones actually act directly on the sexual cells. However, the luteinizing hormones act directly on the Leydig cells. Okay, follicles also stimulate the sexual cells to produce the androgen binding protein and inhibin B. Okay, so here it is given the sexual cells produce androgen binding protein. So function of the sexual cell is given right here. So function of the sexual cell is to production of an androgen binding protein and inhibin B. So inhibin B basically goes to the hypothalamo pituitary gonadal axis and inhibits the production of gonadal hormones, follicle stimulating gonadotropin releasing hormones. Basically, it inhibits the gonadotropin releasing hormone. Okay, or stimulating hormone. I don't know what. I think there are two types of hormones: the gonadotropin releasing hormones and gonadotropin stimulating hormone. Gonadotropin releasing hormone is actually produced by the hypothalamus, and gonadotropin stimulating hormone is actually produced by the pituitary gland on the response to the gonadotropin releasing hormone. So inhibin B actually acts on gonadotropin releasing hormone. I guess, I'm not sure. Androgen binding protein binds to the testosterone and dihydrotestosterone. Okay, to maintain the local high concentration of androgen. Okay, spermatogenesis and sperm maturation is a high androgenic environment. Okay, inhibit the follicle stimulating secretion. Okay, inhibit the follicle stimulating hormone secretion. Therefore, inhibin might act on the gonadotropin releasing hormone. Okay, spermatogenesis is controlled by predominantly by the genes on Y chromosome. Okay, gene that controls the spermatogenesis should be on the Y chromosome. That's why. So this is the basic. This is why the human being is male, because of Y chromosome. So it should be on the Y chromosome. So the factor that controls the spermatogenesis is on the Y chromosome, obviously. Approximately 74 days are required to complete the process of spermatogenesis. Okay, it took us 74 days for one spermatogenesis to complete. Okay, additional 12 to 20 days are needed for spermatogenesis to travel to the epididymis. Okay, that is a lot of days for the travel. So it might take about 90 days for the formation of fully matured sperms. Okay, that's a lot of time. Causes of male infertility. So this is important. So the most important causes of male infertility are hypothalamic pituitary disorders. Okay, 1 to 2% about. Okay, the other is primary gonadal disorders, which is measure up to 30 to 40%, and disorder of sperm transport. Okay, 10 to 20%, and idiopathic causes are about 40 to 50%, unknown causes. Okay, so let's go through it again. So causes of male infertility are from A to, let's go through. Okay, so hypothalamic pituitary disorders, which is about 1 to 2%, very less. Then there's gonadal disorders, primary gonadal disorders, which is about 30 to 40%, and disorder of the sperm transport, which is about 10 to 20%, and idiopathic. So let's consider primary gonadal disorders. There might be other conditions called as secondary gonadal disorders. Now the secondary gonadal disorders can occur in the conditions such as mumps, in which the complication of mumps is orchitis. In that condition, the male can get gonadal disorders. So just for the knowledge, I said it. So congenital undescended testis. Okay, In the hormone secretion, okay, let's talk about the congenital. On descending testes, the hormone secretion remains unaffected, but the spermatogenesis is depressed. Vas difference is absent in about 1 to 2% of infertile males. Okay, Carter-Jenner syndromes. There is loss of ciliary function and sperm motility. Okay, on descending testes, there might be congenital cause that lead to the male infertility. The number one factor is on descending testes. Okay, the hormone secretion the hormone secretion remains unaffected, but the spermatogenesis is depressed. Vas difference is absent in about 1 to 2% of the infertile males. Okay, bilaterally in case 1 to 2. Okay. There is absence of vas difference. Okay, that might lead to the condition of infertility. That will explain it somehow. So Carter-Jenner syndrome, autosomal disease. There is loss of ciliary function. Okay, Carter-Jenner syndrome is condition if there is loss of ciliary function and sperm motility. Okay, autosomal disease. This is okay. Autosomal disease. Hypospadias. So what does this mean, Carter-Jenner syndrome? It means that while taking the history of the patient, it is very important to know if there is any relative who are not able to conceive, because it might be related to because it is there might be a genetic factor that is responsible for infertility. So Carter-Jenner syndrome is one of them. Hypospadias is a failure to deposit sperm higher in vagina. Hypospadias. Okay, so yeah, this right here, this condition is actually called hypospadias. Carter-Jenner syndrome is loss of ciliary function and sperm motility, and okay, on descendant testis. Okay, so congenital factors are on descendant testis, hypospadias, and Carter-Jenner syndrome. So there is a thermal factor, as we know that the spot temperature is best in conditions such as varicocele. Okay, so if the person has varicocele okay, probably interferes with the cooling mechanism or increases the catecholam concentration, or it acts on two ways. It either increases the either interferes the cooling mechanism of the testes, or it might increases the catecholamine concentration. However, no difference between varicocele and infertility has been established. Okay, so let's talk about the infection. Okay, I was talking about this. Mom's orchitis after puberty may permanently damage the spermatogenesis. Okay, so if the person is have had a mumps in his early childhood, he might get suffered from infections. The quality of sperm is adversely affected by chronic systemic illness like bronchiectasis. Okay, chronic systemic illness like bronchiectasis. Okay, bacterial or viral infection of the seminal vesicle or a push to depress the sperm count. Obviously, if there is any infection to the seminal vesicle, there might be condition. There might be improper transfer of a sperm through that pathway leading to infertility. Okay. Mycoplasma chlamydia trachomatis infection is also implicated in this males. Okay. So general factors: chronic debilitating disease, malnutrition, or heavy smoking reduce what spermatogenesis. Okay. So basically, it means that alcohol and cigarette are very dangerous for the fertility. So if you are planning to have child, you should not go for the alcohol as well as smoking. Various synthesis of testosterone are possible by suppressing gonadotropin levels. Okay, let's talk about the endocrine. So testicular failure due to gonadotropin deficiency is called Kallmann syndrome. This is very rare. Follicle stimulating hormone level is raised in idiopathic testicular failure with the germ cell hypoplasia. Okay, syndromes are very important. We previously studied about Cater-Hall syndrome, which was actually a deficiency of ciliary movement of a sperm, which was autosomal autosomal dominant, I guess. Cater-Hall syndrome, or it is basically autosomal disease. So endocrine testicular failure due to gonadotropin deficiency is called Kallmann syndrome, and this is very rare. This is rare. Okay, gonadotropin deficiency. Okay, follicle stimulating level is raised in idiopathic testicular failure with germ cell hypoplasia. Follicle still is raised in idiopathic testicular with germ cell hypoplasia. Hyperprolactinemia is associated with importance. Hyperprolactinemia is also associated with importance. Okay. So this will form in case of diagnosis. In case of diagnosis of infertility, in case of male, we look at the prolactin level as well. If it is raised, there might be high chances that that specific topic, that specific hormone is causing infertility in male. So genetic factor, common chromosome abnormalities such as Klinefelter syndromes might cause might produce an oligospermic male. Okay, gene deletion have been detected in the long arm of Y chromosome for patients with a severe oligospermia and oligospermia. Iatrogenic. Okay, let's talk about the iatrogenic. Radiation, cytotoxic drugs, nitrofurantoin, cimetidine. Okay, these are the drugs. Radiation therapy, cytotoxic drugs. Okay, nitrofurantoin. This one is important. I have read this topic in the previous somewhere. Nitrofurantoin is, it might cause penile cancer as well. I don't know. Cimetidine is basically S2 agonist, I guess. Beta blockers, antihypertensive. Okay, antihypertensive. Wow. Anticonvulsant and antidepressant drugs are likely to hinder spermatogenesis. Immunological factors. Antibodies against the spermatozoa surface antigen may be cause of infertility. This results in clumping of spermatozoa after ejaculations. Obstruction of a efferent ducts. The efferent ducts may be obstructed by infection like tubercular, gonococcal, or surgical trauma. Following vasectomy, in Young's syndrome, there is epididymal obstruction and bronchostasis. So bronchostasis is one of the main cause, one of the important causes that might lead to infertility in case of male, because it might cause epididymal obstructions, and the condition is called Young's syndrome. No. In Young's syndrome, there is epididymal obstruction and bronchostasis. However, bronchostasis also causes infertility. That's as we have already studied earlier. And where was it? It causes it. So Young's syndrome is a condition in which there is epididymal obstruction as well as bronchostasis. This Ullmann syndrome. Okay. Failure to deposit sperm high in the vagina. It was actually hypospadias, coital problem. Okay, it was condition called as hypospadias. It was failure to deposit sperm high in the vagina, but it might be due to improper. It might be due to erectile dysfunction as well. Okay. Ejaculatory defect. Okay. Premature retrograde or absence of ejaculation. Okay. Hypospadias. Okay. This the main causes. This is congenital causes. Erectile dysfunction is not a congenital causes. This is congenital cause. Sperm abnormal. So I'm looking Google for the hypospadias. Yes. What is hypospadias? So just a minute. Hypospadias. Okay. So it says that hypospadias is a condition in which the opening of the urethra is on the underside of the penis. Okay, underside. Okay. Epispadias and hypospadias. I've heard this topic before. Basically, the urethra should be at the upper part of the tip of the penis, but in this case, it is at the lower part. Hypospadias. Okay, so this is one of the fact. This is one of the important fact. I don't know if you can see the Google. No, you can see. It's okay. So we have already studied about 33 minutes. I feel like taking break because Pomodoro technique it is important. So I'm taking 5 minutes break, okay? The fuck? Hello? Damn. So I'm constantly having any kind of disturbance in this video, a kind of noise. This is depressing. Yeah, I'm having it right now as well. The sound is like crrrr. I should know how to talk to you. It's constant. There might be a problem with my mic. So you're now hearing my voice from the out of the mic, not from the mic. Okay. Now you can hear me. Hello. There is problem in the stream. The voice. There's some kind of disturbances. So I think I'm going to end the stream right now and maybe try it later. There was problem with the stream. There is problem with my audio. So I am actually going to fix this. This means server stream will end here. Okay guys, I'm going to end the stream. I don't know if you can hear my voice or not. I think you can. There is constant irritating noise that is appearing in the background, and I need to figure out how to fix it. So I'm going to go and fix it. I think it is problem with my mic. So I might try to come just a few. I will come again after a few minutes if I could figure it out. Till then, goodbye guys. I'll be back.